What are hemorrhoids? Why does my bottom bleed? Why do my hemorrhoids itch? Why don't my hemorrhoids itch? How do I prevent them? Is surgery the cure? Most people have heard of hemorrhoids, but few know exactly what they are. It's time we got to the bottom of this. Today's Dr. Doodle is on the down and dirty about hemorrhoids. First, I'm going to draw a picture of the anus. Anus is Latin for ring, so your anus is the ring that your poop comes out of. Surrounding the anus are a bunch of blood vessels called the sinusoids. They act as a cushion to help protect the anal sphincter from hard bowel movements. They also add extra volume to keep the anal canal closed to help avoid leakage. A hemorrhoid occurs when one of these blood vessels starts to pouch out into the anal canal itself. It can start out to be small but can grow larger and larger. The hemorrhoids can just sit there as a lump, or sometimes they can break open and bleed. So why is it that some hemorrhoids are painful or itch and some are painless? Well, about a third of the way up the anal canal, there's an invisible line called the pectinate line. The anal canal closer to the exit from the pectinate line has a lot of nerve fibers, so hemorrhoids close to the exit can be very painful or they can itch a lot. On the other hand, there are no nerve fibers deeper inside the anal canal, so in there hemorrhoids are not painful. An internal hemorrhoid is a hemorrhoid hidden on the inside, whereas an external hemorrhoid is a hemorrhoid that sticks out. When a hemorrhoid has a blood clot in it, we call this a thrombosed hemorrhoid. Not all rectal bleeding, pain, or problems with your bottom are hemorrhoids, so if you have an issue, make sure you get it checked out. Major cause of hemorrhoids is too much pressure in the abdomen. This can occur because of several reasons. Prolonged straining while on the toilet, reading, or using your iPhone can be a problem. Frequent diarrhea definitely can make things worse. But constipation is your number one enemy. Some medical conditions cause hemorrhoids. They're extremely common in pregnancy. Drinking too much alcohol can make hemorrhoids much, much worse. Hemorrhoids are extremely common in liver failure, but most people with hemorrhoids just get them without any serious medical cause. If you do tend to get hemorrhoids, the best way to treat them is try to avoid getting them in the first place. The first line of avoidance is making sure you get enough fiber. I recommend counting fiber and going for at least 30 grams of fiber every day. To get to this, you're gonna have to go for a ton of fruit and vegetables, at least 5 to 10 servings total. Fiber supplements such as Metamucil has about 3 grams of fiber, so just doing that isn't gonna get you there. You really have to go for the fruits and vegetables. Once you have enough fiber, the next essential component for avoiding constipation is making sure you're drinking plenty of water, staying well hydrated. There's no exact amount of water you need. Your water requirements change depending on your activity and other factors, but as a good rule of thumb, if you have constipation, you need to be drinking at least 6 to 10 cups of water every day. Once you have the water and fiber component down, the next aspect is staying physically active. Regular physical activity makes a huge difference in constipation. And finally, other than avoiding the foods that you know make you constipated, the last thing we have to do is really the hardest thing to do in the long run, and that's really getting to and maintaining a healthy weight. If these natural techniques aren't taking care of the problem, the next step is going to the pharmacy and picking up some over-the-counter products. The main two preventative agents that are over-the-counter at the pharmacy are either fiber supplements or, if you have problems with constipation, using a stool softener. If you have active hemorrhoids that you want to treat, the first line is doing all the exact same things that we do for prevention. After that, you can get over-the-counter products that are really aimed at relieving symptoms. These really can help the itching. These include bag balm, witch hazel, topical steroids such as Anusol, Tux pads, and other products such as cyst baths. There is one final treatment that I haven't talked about yet. Let's face it, hemorrhoids are annoying. No one wants them. We all want to get rid of them. Wouldn't it be great if there was a simple way to just take care of the problem? Usually the first thing my patients ask me is, what about surgery? There are a variety of surgical procedures to choose from, and if someone has prolonged bleeding, it can be helpful. Unfortunately, after surgery, hemorrhoids often return. So often, it's best just to wait it out. Now, it is natural to get angry at a surgeon when they tell you they don't want to do surgery on you. But if you're telling a surgeon you're going to pay him $500 to do a procedure and they say no, they really are looking out for your best interest. Most doctors will agree that it's best to try everything else before opting for surgery. As a review, hemorrhoids form from blood vessels called sinusoids that can pouch out into the anus. They can either just sit there or sometimes they can bleed. If they're way on the inside, they're not painful at all, but if they're more on the outside, they can be very painful or itchy. Now you know more than you ever wanted to about hemorrhoids. And remember, stay healthy.
Help your friends and family stay healthy by sharing this video. For more Dr. Doodles, go to drdoodle.com or follow us on Facebook, Twitter, and YouTube.